So first of all, how do you think your mental health is as a clinical doctor who sees so many sick people on a regular basis?
It's definitely a challenging occupation. We see sick patients all our lives since we became doctors. In my case, I've taken one day at a time, and I've sort of like along my career chosen a path where I'm an orthopedic surgeon. Let me start that off with. And orthopedic surgeons, we see sick patients, but we see patients who are after treatment, they regain back their mobility, so it gives us a lot of cheerfulness.
I think this is one of the challenges that most of the doctors face during their career, especially in the obstetrics and gynecology is a very stressful specialty, and fortunately, most of the events are happy events.
We really have a good environment, working environment. So
I think my mental health is strong enough as a clinical doctor. I used to face sick patients, sick people, and occasional death in this subject. So I need to remain calm and quiet and strong enough as a important surgical doctor here.
Yes. What helps you keep going? How do you manage your mental health?
I definitely agree with the fact that being a doctor is a challenging occupation. We see a lot of sick patients along the way, and we do routine same things. It puts a lot of stress on our mental state, and I think a good, solid, friendly working environment, a good support from the family, and having a solid religious background, and looking forward to have a beautiful time with family after a hard day's work helps a lot in keeping our mental state, or my mental state in this case, in the best shape for all these years.
Because even dealing with sick patients, very sick patients, and then seeing them getting out of this, you save lives. It can completely keeps you going and gives you all the motivation you need.
Really, this neurosurgery is really a high pressure specialty, and most of these patients are critical. So, in each patient, when I treat, it should be in my mind, then I will try to do from my life, from my mind, and from my practice, what I have earned from this practicing life.
Seeing the result of all your efforts and how people and also the society benefit from your great efforts. We are delivering patients, we are relieving pains, we are saving lives, and these are very, it gives you the job satisfaction that keeps you going despite the challenges and the stresses.
Welcome to Marina and your colleagues. Now discussing mental health struggles in your workplace.
From the society, or the where the place of your work, the admin is very important. Needs support, feels down, then there is certain programs that can lift this one up and get them improved gradually.
I have this kind of environmental support, that is the peer support, it's really important.
Really feel free to face or discuss this issue with my colleagues, and they are actually helping. And I think all of my colleagues are friendly enough to share of this practice.
Good, strong support system in our hospital, and with all this, we give a lot of time off for them who has a lot of mental pressure, and with all this support and all this positive approach from the entire staff in the hospital where we're working, we managed, all these years we managed to actually keep the level of mental issues amongst health workers to the minimum.
Happiest and most heartbreaking moments. How do you cope with those emotions?
is challenging, as I said, but the moment of happiness is considered the relieving moment that can remove all that sadness and stress that you have. On the other hand, whenever you face such a sad or high risk situation, you need sometimes you need to go out, you need to have breaks, you need to change your the atmosphere, and the support from the colleagues, the groups outside is very important in this specialty.
If I lose any patient, it's really very really mentally stretching for us. But if I know I did maximum from my knowledge, from my practice, and from my heart, and from my brain too, then I will remain calm, and it will make me give my strength to do next surgery as well as next patient. So
to see them moving, being able to move, and being able to go back to their daily activities.
How do you manage work-life balance, especially with on-call duties, emergencies, or long surgeries?
There are days that, many days that I'm sort of like trapped in the hospital, working to treat patients, to finish the job, finish the work, finish the surgeries, to make sure the patients are comfortable before I can get home. Many days being back home late at night. But there are ups and downs in medical practice in hospital in terms of the patient workload and volume. When the days are down, when less patients, when there's less work, I maximize the opportunity to be home early, to be with the family, and to use that extra time to do things that I love to do, and to also to pursue my passion in areas like which is not related to my current practice.
How
So
important
that's
is sleep, exercise, and time away from work in maintaining your performance in the operating room?
It's extremely important because working in an operating environment as an orthopedic surgeon is very demanding physically. I can at times stand for 3 or 4 hours alone, especially working in a private setup. You don't really get support. You don't have younger junior doctors to help me out. So keeping a healthy heart, a healthy bone, a strong sense of commitment, and a strong sense of understanding and realization that I need to keep my body healthy is very important. So I try to squeeze time to do some running, to swim, and to do some weights.
sleep, exercise, and time away from the practice is more important factor to keep our brain active. Everyone should follow this rule. We should work, but beside the work, you need to rest and need to enough supplement to the brain to work hard. So it is always in your mind. It should be always in your mind. You do, but you always keep your brain rest frequently. It is more important, and side by side, we need exercise for our physical capacity, and enough rest for the brain and body too. Is most important.
So even though they are healthy workers, they are burnt out and they have the stress, they have the psychological effect, they are working stressed out, so they don't take care of that much when only they take care of their physical health. So in that perspective, it is really stigmatized because they do not talk about it. Through the lens of public health, the health workers, like they have this burnout, definitely, the depression, the anxiety, post-traumatic disorders, and there's another one that is the moral injury. So these are some of the aspects they have these kind of problems in mental health. The data that is coming up, it's very overwhelming to see the picture, the hidden aspect that the community or people are not understanding. But the data is, we are having those data in our hand, and we are saying that those problems are really not being seen because it's hidden, and we as a public health, we can bring this picture to the tip of the iceberg so that people can come and have this problem taken care of. So we need to have a very good team support, peer support, and definitely institution of
Patience
support.
is
So
my encouragement. I always believe if I can do better for my patient, if they believe that my doctor is trying for better life for me, they will never hurt me. So I always try to remain in this profession and will remain lifelong in this profession.
So whenever we have any physical problem, we just go and visit the doctors, right? But when the healthcare worker also, they have the same, you know, like the human being instinct.
It should be give courage and encourage from that. It is the duty of the society to ensure the doctor's safety and doctor's security as long as the doctor will practice in the right way. I think always each doctor and every doctor try to do hard for his patient, and if
The people, the patients, the families, to know that we are human beings. We can do mistakes, we can have our own stresses, we can have our own circumstances that might not put us in the good shape that they wish to see. And sometimes it can happen. For people, they need to understand this. People, they need to acknowledge that we are human beings. We have our stresses. We are doing our best for them.
Just don't look into the physical health, because this mental, psychological aspect of things is very important. You should need to address this. If you feel like you are being stressed, just leave that moment and enjoy yourself. Take care of your mental health. Mix with people, communicate. If you need professional advice, go seek for that. Just
For the new doctors out there, go all out, realize your potential to be the best doctors you can in whichever field you choose to be. But remember to divide your time equally between, like I said earlier, between your family, your religious commitment, time for yourself, and also to make sure you live a healthy life in terms of exercise, proper diet,